Thanks so much, Brett. On the surface, vein disease can be visually unpleasant. However, leaving it untreated can cause even more serious internal and external complications. Vein experts Calcagno and Rossi want to help you avoid those serious complications, and Dr. David Calcagno is here today to talk about vein disease. Welcome back to the program, sir.
Thank you, Amy.
Y'all have been on a few months now, and you've been helping us so much with vein treatments, vein disease, understanding it.
Yes, over the last several months, we've covered several aspects of varicose vein disease, ranging from cosmetic treatment of small spider veins to some of the new minimally invasive methods for treating larger varicose vein disease. Today, we're going to focus on the more severe end of things, and that'll be complications that can occur if varicose vein disease is left untreated.
Okay, and that's why we should kind of know what to look for. So we're going to take a look at a series of photos. Let's start with the first one. How do you say this? Stasis?
Stasis.
Dermatitis?
Yes.
Okay, what is that?
What can happen, as we talked before about on the show, when patients have varicose vein disease, the valves can malfunction. So instead of the blood returning to the heart, it actually goes backwards down into the leg. That causes the vein pressure to get quite high. That high vein pressure is what causes a lot of discomfort patients might have: heaviness, achiness, tiredness. And at a more advanced degree, the pressure can be so high that the blood actually seeps out of the veins into the skin.
Ooh.
There, the red pigment in hemoglobin can turn brown when it oxidizes, giving that brown color. And the white blood cells, when they seep into the skin, cause inflammation. That inflammation can make the skin thick, cause discomfort, and make the skin very prone to injury.
Oh wow, so we do not want this to happen, but it can look even worse than that too, because we're going to put up the second picture now. This is an ulcer that you're going to show us.
Yes, this is a more advanced problem when the venous high blood pressure continues for too long. The inflammation from the white blood cells can cause such inflammation that the skin actually dies, causing a sore.
Oh my gosh.
Even in the best of hands, in the best wound clinics, these sores take a long time to heal, months or even years. Now, fortunately, it's not hopeless. If you correct the vein valve leakage even at this late stage, it still can heal the ulcer. But it's better to treat things ahead of time.
Of course. That looks very painful, very uncomfortable. And what about this third image?
This third image is what's called superficial thrombophlebitis, which means clots and inflammation in surface veins. Now, while it's not as dangerous as a deep vein thrombosis, which has the propensity to go to the heart and lungs, a surface clot can still be quite a problem. They can be quite painful, can take a long time to go away, and even in some of the cases, when they get too close to the deep veins, they can act like a deep vein clot and break off and cause problems in the heart and lungs. So again, like the ulcer, still treatable, but better to treat earlier.
Yes. Any other kind of ailments maybe that you didn't bring pictures of today, but that folks can experience?
The only other thing I would touch on, and we don't have any pictures of because we're not there when it happens, might be bleeding. Normally when someone cuts their leg, as long as they have vein valves that function, the vein pressure is not too high in the legs and you just get a little bit of bleeding. But if someone's valves are leaking and the vein pressure is very high, just the most minor of cuts in the leg can be quite remarkable. If any of your viewers should have these problems, the thing to remember is just lay down so your heart's flat on the floor and put your leg up, and that'll reverse that pressure gradient until you can seek help.
Yeah, and then they should call you. So you do have an upcoming event. Tell us about that later this month.
Yes, in I believe March 25th and 26th, we're having a free screening. If patients have any questions about if the varicose veins are something they should do something about, feel free to call and see us at the screening, or just call anytime.
Very good. VeinExpertsPA.com. Thank you so much, sir.
You're
Always
welcome.
great information.